Hello, my name is Abby Dees, and I'm an undergraduate student intern at the Iowa Pork Industry Center. Today we will be discussing periparturient sow health to minimize reproductive losses such as stillborns and mummies. Reproductive losses at farrowing are costing producers thousands of dollars in potential profit. According to PIC, decreasing stillborn piglets in the farrowing house by just 1% could save producers 40 cents per weaned pig, equating to $12 per sow annually. It is important to identify factors that can minimize these reproductive losses while also maximizing sow health. This video will describe what is causing an increase in stillbirth rates in the sow in the industry, how to identify a stillborn piglet versus a mummy, steps to optimize periparturient sow health, and proper nutrition for a sow around farrowing. As the industry genetically selects for higher prolific sows, an increase in stillbirths has occurred for several reasons, one of which is farrowing duration. As the length of farrowing increases, the piglets are retained in the uterus longer and further increases the risk of asphyxiation. Additionally, the sow will become weaker and have weaker contractions to expel the fetus as farrowing progresses. This duration increase can be caused by a wide range of factors, including large litter sizes, stress affecting hormonal imbalances, nutrition, improper body score, anemia, and various diseases. It is important to identify factors that can reduce farrowing interval to minimize stillbirths and protect sow reproductive health. There are several ways to identify stillborn piglets and mummies. Stillborn piglets are classified as piglets that die during or after the farrowing process. This is typically caused by asphyxiation due to their blood supply from the placenta being cut off by uterine contractions or by being retained in the uterus for too long. The color of stillborn piglets can also offer insight into the timing of death. Discolored piglets likely died during farrowing when uterine contractions fracture the fluid-filled sac that surrounds the fetus and contains fetal waste. The image in the upper right is an example of this discoloration. Mummies, on the other hand, are considered fetuses that die between days 40 and 100 of pregnancy. They have a mummified appearance because they were partially decomposed and absorbed in the sow after they died. There are many causes of mummified fetuses, one of which is a large, crowded litter. When the uterus gets too crowded, a fetus can be cut off from its blood and nutrient supply. If mummified fetuses are similarly sized, it is most likely caused by an acute stressor, such as a fight between sows or intense heat over a short period of time. Variation of sizes can be caused by chronic stressors, including porcine parvovirus. PPV, pseudorabies, and PRRS also cause mummies and stillborn piglets. The image on the left shows a mummy that died early in gestation. The image on the lower right shows a mummy and a stillborn next to each other. You can see that the mummy on the left is less developed and died earlier than the stillborn piglet on the right. There are several strategies to minimize these reproductive losses before farrowing even begins. These strategies come with one goal in mind: to reduce stress in the sow. First, flag and closely monitor sows that have had stillbirths in previous farrowings. These sows are more likely to have stillbirths in future parities compared to those who did not have one the farrowing prior. Constipation creates a problem during farrowing by creating obstructions in the fetus's pathway. To combat this, consider feeding a laxative ration 3 to 7 days before farrowing. Handle the sows gently during the loading and movement process to reduce external stressors. To reduce heat stress, consider sprinkling water on the sows during high temperatures. The ambient temperature in the farrowing house should be between 21 to 22 degrees Celsius or 70 to 71 degrees Fahrenheit. While farrowing is occurring, there are many methods to ease the process in order to minimize stillborn piglets. First, observe the sow and her behavior once farrowing commences and record the time, number of live-born and stillborns, and times checked on. You can use these records for future parodies. Additionally, observe for signs of discomfort and stress. Typically, the sow should be able to complete the process on her own in the early stages, as long as she is not showing signs of discomfort or difficulties. If she is showing these signs, help may be required. After 6 to 7 piglets have been born, allow for 20 minutes after the last piglets have been expelled to give assistance. When assisting the sow, use good hygiene practices by using warm water, a mild antiseptic, OB arm sleeves, and obstetric gel. Pull the piglets carefully, making sure not to cause any uterine or cervical tears, as well as to reduce chances for asphyxiation. When the fetuses are expelled, remove fetal membranes and place under a heat lamp. If a sow is assisted during farrowing, consult your veterinarian about the need to administer a long-acting antibiotic and closely monitor the sow after farrowing is completed. It is important to take steps to ensure sow health after farrowing. First, make sure the sows are getting up to eat at least twice each day after they farrow. This also helps to ensure that the farm staff are visually monitoring each sow. Assess if the sow is at risk or suffering from a disease by observing for lethargy, vaginal discharge, loss of appetite, or fever. At-risk sows include sows that were assisted in labor, are obese, had multiple stillbirths, experienced acute stressors, or had a prolonged farrowing duration. In the case of uterine inertia, piglets may be retained in the sow, causing a risk for infection, so treatment with antibiotics may be necessary. Lastly, the placenta should be expelled within 4 hours after farrowing is finished. In the case of a retained placenta, oxytocin and an antibiotic may be given to stimulate contractions in order to expel the placenta and fight infection. Proper nutrition can have a large effect on the reproductive health of the sow. It is important to properly feed the sow during gestation to provide enough energy for maintenance and embryonic growth, while also keeping appropriate body condition. Obesity can increase the length of farrowing by storing hormones that slow the release of oxytocin, thus delaying uterine contractions. This figure shows how the amount of back fat relates to farrowing duration. As back fat increases, so does the duration of farrowing. Conversely, a sow with a low body condition score and a severe energy deficit can result in low birth weights and weak piglets. Additionally, constipation can negatively impact farrowing time as it obstructs the pathway of the fetus, creates an inflammatory response, or can cause pain and discomfort, leading to further inhibitory hormone secretions. Another key factor of nutrition is the calcium level of the sow. Maintaining calcium homeostasis is critical for parturition because it partners with oxytocin in the smooth muscle of the uterus to help it contract. It is also vital for colostrum supply closely following parturition. Thus, avoiding a calcium deficiency is crucial. In conclusion, there are many management strategies to maximize sow health in live-born piglets, so it is important to choose methods that best suit the specific operation. Regardless of the procedure, keeping the environment stress-free and staying observant in the farrowing house is critical to ensure sow and piglet well-being. This work was completed as part of the Improving Pig Livability Grant, supported by the National Pork Board and FFAR. For more resources like these, go to piglivability.org.